Today's session will focus on Saathealth, the AI-powered personalized digital health platform. My name is Ebele Anidi, and I'm the Director of Partnerships and Engagement for the G20 Global Innovation Hub for Improving Value in Health. The Hub Innovation Series aims to foster and support innovation across the G20 member states by spotlighting the innovative, practical, and impactful solutions from inspirational health pioneers from around the world, the folks who are at the forefront of working to usher in a new era of high-value health systems. Today, through a partnership with PATH, the Hub is excited to welcome the wonderful team from Saathealth, an impactful AI-powered platform for personalized digital health. Saathealth was actually a recent winner of the PATH Primary Healthcare Tech Challenge. Dr Aakash Ganju and Aditi Hazra-Ganju are joining us today to share the Saathealth story, a platform that has already engaged more than 30 million people from across the Southeast and Central Asia. Welcome, Aakash and Aditi.
Thank you very much, Ebele.
Thank you. It's a pleasure to be here.
I'm so excited for today's conversation, and maybe let's kick things off with you, Aakash. You know, this AI-driven omni-channel platform is such a unique idea. It's such an incredibly innovative solution. Can you share the origins of Saathealth? You know, when we think about the innovation cycle, can you walk us through that journey for Saathealth, from ideation to collaboration to implementation, and then ultimately the value creation that's occurred thus far in the journey of Saathealth?
Yes, thank you very much, Ebele, for this opportunity for Aditi and me to speak about our experience at Saathealth. I will cover the origin of Saathealth in 3 sections. I'll speak about why we do what we do, what is the purpose of our existence. I'll speak then about what it is that we exactly do, and then I'll talk about how we go about reaching and empowering millions around the world with personalized digital health. If I can have the next slide, please. So the purpose of our existence and why we do is really an intersection of our personal and our professional journeys, as well as what's happening in the macro environment around us. So both Aditi and I have worked in healthcare for close to 25 years. We started our careers working in the private sector, and then for the last 14 years, we worked at the intersection of public health technology and consumer empowerment. About 14 years back, we started working on building digital platforms for HIV/AIDS patients across rural India. And then we did a lot of work building digital platforms for maternal and child health in multiple countries around the world. And both of these deep immersive experiences convinced us that consumers or healthcare consumers or beneficiaries are increasingly ready to be at the table. They don't want to be told, they want to participate in their own healthcare journey. And that was a very, very important insight for us that led to the inception of Saathealth. While we were learning about health consumers and how they are increasingly taking charge of their own health, we also realized that many organizations around the world needed new agile tools to reach and make an impact on their health consumers. If you can go to the next slide, we realized that there is a massive imbalance in demand and supply around the world. The demand for healthcare is rising rapidly in many countries, most countries around the world. The supply is extremely limited. We don't have enough healthcare workers, doctors, or nurses to address the booming demand. And that's leading to massive increase in cost, which is rising higher than inflation in most countries around the world. And there is a need to start looking at innovative business models. And our thesis is that health consumers need to be empowered to start investing in their own preventive health, and health systems need to take charge and start doing more preventive health interventions with health consumers. So Saathealth, now I'll talk about what it is that we do. We are a preventive health education, awareness, and demand generation platform. Our focus is to reach consumers and beneficiaries wherever they are in local languages with preventive health content, generate awareness, educate them, and then guide them towards products and services with supply-side partners. We work with a lot of great supply-side innovations, and there's a lot of supply-side innovations that are needed, but our focus remains on the consumer side. How do you reach them where they are? How do you engage them? And how do you really guide them to start taking charge of their own health? That's the raison d'etre of Saathealth. That's what we do. How we reach these consumers? is really dependent on where they are. We use both online and offline tools to reach them. We do have to acknowledge that the digital revolution in the last 10 years especially has made it much, much easier to reach health consumers and beneficiaries using digital tools. So when we think about reaching consumers and beneficiaries where they are, I think our approach is not digital also, but digital first. And there are three advantages to thinking of digital first demand side interventions. The first is the cost of reaching and acquiring beneficiaries or health consumers is much lower than in traditional models of healthcare delivery. The second is just using digital platforms allows you to understand user insights on a real-time basis and continue to innovate and iterate on the solutions that you're providing these health consumers. And finally, I think think of a health system that has access now to high frequency health consumer data. It allows them to look at what's happening with the health consumer, what their needs are, and implement real-time innovations. Think of the massive impact this could happen when the next pandemic happens, right? So our approach is to think about digital first health innovations. We're also beginning to use AI, very excited about that, to target users with products and services that they absolutely need. This is a very exciting and nascent area. We already have 4 peer-reviewed publications in this space, and we are super excited about the impact that AI can have on really targeting consumers with what they need in terms of interventions and preventive health products and services. So in a nutshell, Ebele, if you are a health system that's looking to use health consumers at scale, educate them, engage them, increase awareness, and then guide them towards your products and services, we want to be talking to you. We want to see if we can help you achieve your health goals.
That's great. Oh, sorry, please go ahead.
No, I hope that gives a sense of where Saathealth works and the unique positioning that we've got for ourselves.
Certainly incredibly insightful and helpful. And I think your primary focus, your raison d'etre, as you mentioned, Aakash, to focus on the beneficiary, focus on the consumer, it's incredibly helpful in framing the whole reason that you and Aditi work together to launch and establish Saathealth, as well as your focus in leveraging this omnichannel platform to ensure that people feel supported in their journey, in their own individual personalized health journey. I want to bring in Aditi here. Aditi again is the co-founder at Saathealth and COO. Aditi, I would really love to hear you speak to the unique Saathealth approach. What is that approach for catalyzing behavior change? And then on the back end, as we leverage this time together to reflect on your journey to date, maybe you could speak to some of the challenges as well as the enablers that have really shaped the Saathealth journey to date.
Sure, thanks, Ebele. And let me begin by going a little bit more into detail. And if I could have the next slide, please. I think Aakash talked a lot about how we engage with the end user and how we give a very take a very user-centric approach to delivering healthcare information as well as influencing health-seeking behaviors. But we did want to spend a little bit of time talking a little more in detail about how we do this. Now, over the years, as Saathealth evolved, we learned that it wasn't sufficient to just build a digital health platform and expect users to come to it and use it the way we wanted them to. It made more sense to reach out and meet the users where they are, give them the information through channels that they're used to accessing regularly, make healthcare information and awareness a part of their natural digital appetite, so to speak. So take it to them wherever they are. And with this realization, we started developing what we call an omni-channel approach. So we don't only use a particular mobile application, but we use various aspects like a mobile app, a web app. We use social media extensively. We use YouTube channels. We use even now more and more WhatsApp and Messenger chatbots, as that's where the users are. Once we have reached the users through these omni-channel platforms, we get them into a common gamified infotaining learning journey, which takes them through a step-by-step process, giving them behavior change communication in the language that they understand, in the way that they understand. So if it's more, for example, in India, what works great for us is taking a very Bollywood type of approach and really engaging the users in a way that they don't find health content depressing or tiring. They find it more uplifting and aspirational. So that's been our content and engagement approach. Once we have them going through this entire gamified journey, we are able to nudge them towards behavioral changes that we need. It could be redirecting them towards certain types of health products and services, or leading them into lead generation campaigns that we are running. At the same time, we are able to see through the real-time analytics that we're tracking, the knowledge shift, the behavioral changes that they're displaying, as well as get deeper insights into how users behave on digital platforms. And all of this using our AI algorithms, using constant iterative awareness, and so on. So that's how we are able to take all the users through this journey and get them to towards health-seeking behaviors. I think if we move to the next slide, I can talk a little bit about what has been challenging for us as founders of Saathealth. And one of the main challenges that we've faced has been to explain our positioning. And now that you have a little bit of background about what we do, I'm sure you understand that we are an organization that can engage users and then nudge them towards healthcare products and services, irrespective of which geography they're in, what therapeutic area they have a need for, and so on. So this geography and therapy area agnostic platform is a little difficult to explain, because most people are used to platforms that can, maybe say cure diabetes, or provide a solution to lose weight, or provide a solution that can help mental health. They don't understand about a horizontal approach where the journey is the same, irrespective of whether you're suffering from mental illness or you're just looking for preventive health for your entire family. So this unique positioning, where we are able to support health organizations reach any user, irrespective of what it is that is bothering them, is what we find very difficult to sort of explain. And that's I think been one of our biggest challenges. But I think we've now reached a point where we ourselves are clearer about what we have to offer. We are able to articulate our positioning a lot better, and thanks to platforms like this, we're able to bring it out and talk about what we do much better. So that's been a great help. I think the second challenge that we've faced has been that we've been very clear that our expertise lies and the need lies in better user-facing solutions, and that's really where we are good at, and where there's a serious gap that we're trying to fill. At the same time, we need to complete the care continuum by partnering with like-minded partners on the supply side or the delivery side of healthcare. So it could be health systems, it could be hospitals, it could be people who provide pharmacy services or telehealth services, and so on. But this process is not as easy. You need to make sure that your partners are like-minded, they have the same alignment as you, they have the same they're impact driven like you are, and so on. So this has been a major challenge for us to circumvent. I think the third and the most sort of personal challenge for both Aakash and me are that we've both been very passionate about building impact focused enterprise. We want to balance impact with our business goals. And that, as you can imagine, is easier said than done. But we've tried very hard in the last 5 years to integrate this impact focus into the core offering of our work, and that's I think been the most exciting challenge to tackle in this entire journey of building Saathealth. And we've been able to do this with some fantastic support from people. And one of the reasons why we were able to expand and experiment so effectively was with the help of grant support that we received from some very forward-thinking, impact-focused organizations. And that's been a key enabler for us to get Saathealth to where it is today. I think the second thing that has worked very well in our favor has been our focus on building a multidisciplinary team. And this team so we've combined expertise in healthcare with expertise in data sciences, with expertise in technology, with external communications. And it's all come together very beautifully to deliver the goals of what Saathealth is trying to achieve. That is, reach the users where they are with infotaining content, get them to display behavior change, and to be able to track and nudge them towards uptake of healthcare services and products. So I think that sort of summarizes where we are today with the challenges we've faced and the enablers that have helped us along on this journey.
Incredibly helpful and insightful, Aditi. Thank you so much. I mean, I think you've laid out in a very honest and helpful way that you and Aakash have set a very ambitious vision for Saathealth, and your ambition is focused on a new landscape in which people feel empowered and well-informed to dictate and navigate their own personalized health journeys. And when you set out that kind of ambitious vision, you also are going to come across a number of challenges. And so I think for us at the Hub and the audience tuning in today, it's really helpful to hear how you've actually turned those challenges into opportunities to think differently, to organize your business and your approach differently, but also how you've benefited from a growing coalition of supporters, as well as leaning on, as you described, a really strong and multifaceted, multidisciplinary team. I want to bring Aakash back into the conversation here, because at the Global Innovation Hub, one of our main responsibilities is really elevating and spotlighting innovations for our membership, which includes representation from across the G20 plus nations. And so, let's take a look ahead. And as we think about invested stakeholders from across the G20 plus countries, what are your aspirations for the future of Saathealth?
Well, our aspirations for the future of Saathealth are also linked very closely with our aspirations for global health around the world. So I think that's really important to us. I think one of the things that I would say to the G20 nations that are watching this is there's great work happening on the supply side, great innovations. But how do you make sure that you reduce the cost of getting those innovations to people in far-flung parts of your country, right? How do you make sure that you create this pull for people to come and ask for these innovations, right? So I think one of the calls for action that we would really encourage everybody to think about is think more about demand-side innovation. We are one of the players on the demand side. I'm sure there are other ones as well, but it's really important, and consumers are hungry. They want to be part of this journey. They no longer want to be told what they should be doing in healthcare. So I think that's one call to action, and that aligns very well, obviously, with Saathealth's own aspirations. We are a social impact organization, so Aditi mentioned that it's really important for us to track our impact and our business goals, and this is a graphic that shows you how we track our social impact on a monthly basis. We worked across multiple indications, multiple geographies, multiple languages. We've reached more than 50 million people now, engaged over 1 million people, and generated health actions, health-seeking behaviors in excess of 100,000. And let me take two instances of how this graphic comes together for us. So one of the things that we're working on is this massive program to increase financial literacy around health products and services with the missing middle 500 million population in India. We launched this last year with support from ACT grants in the Swiss capacity building facility. We are reaching people in the millions every month in local language. We are engaging with them, and we are guiding them towards services from our supply side partners. And I'm talking about telehealth services, medical device services, insurance products, and so many more that are designed for the wallets of these consumers. I think this is one really good concrete example of how the entire journey works. The other one is the work that we are doing in Central Asia with the Ministries of Education and Health, where we are reaching out to children and adolescent youth around the entire theme of emotional resilience and mental health, which is a hugely important subject. By this time next year, we expect to reach millions of young children and adolescents, again, engaging them with preventive health content and helping guide them towards products and services. So I think these are some examples of what can be done. My biggest call to action would be think about demand side innovation, because we cannot continue to do business the way we've done it in the last 50 years. We need new innovative models. So we are extremely proud of what we've done in the last 4.5, 5 years, but there is a long way to go. And our aspirations for Saathealth are really aligned with the UN SDGs and the aspirations of global health for everybody. So I want to stop there, Ebele. Thank you again for this wonderful opportunity, but happy to take any additional questions that you may have from what Aditi and I shared.
No, thank you so much, Aakash and Aditi, and thank you, Aakash, for laying out that very clear call to action. I think that was both a call to action and an invitation to our membership and interested stakeholders across the G20 Plus who want to engage with and connect with Saathealth. So I appreciate you naming that. And I also want to use this time to express a sincere note of thanks and gratitude to our partners at PATH for connecting us, and for both of you and the work and the impact that you're driving through Saathealth, the vision that you set for your organization. It was such a pleasure to hear your insights and your perspectives. You know, for everyone tuning in today, if you're interested, you can always stay up to date on our work via our respective websites, joining our LinkedIn pages, following us on Twitter. We'll post that at the end of this episode. But, you know, on behalf of the Secretariat for the Global Innovation Hub, we sincerely hope that you enjoyed today's episode, and we look forward to having you tune in for future Hub Innovation Series episodes. Thank you all so much, and take care.
Thank you. Bye-bye.